Hi, I'm Kim Rayner, Clinical Lead of Innovation and also the Nurse Practitioner here at Micah Projects. So when COVID hit here in Brisbane, it was a pretty hectic period of time at Micah Projects. We kept delivering our services. We haven't stopped here at the Inclusive Health Clinic or in our community-based outreach programs. Really the only change has been to group work. Outside of that, we have continued to work and it's been a really busy time. I think one of the things that's been fairly significant was just having to reorientate new processes into the way that we deliver care here at the clinic. Consider our practice in the community in terms of managing social distancing, making sure we had enough PPE, which is the protective equipment to wear, making sure our staff was safe, making sure that the people we're supporting were safe. So there was a lot of work taking place across Micah and we're all fairly heavily involved in that. So it was a fairly exhausting time, particularly in those first 6 weeks, but we just kept working.
My name is Arif Mansouri. I'm the Inclusive Health Clinic and Wellbeing Hub Manager. We provide clinical services which ranges from GP services, dental services and allied health services. Allied health services includes myotherapy, acupuncture and shiatsu massage. Recently we had an addition of fourth speech psychology services which provide psychology and counseling services to our patients. When COVID-19 came in act, the most services which were affected at the clinic were the dental health services and allied health services, as we have to completely stop those services. Normally we have consultation which lasts from anywhere between 15 to 45 minutes an hour. We give at least 30 minutes for each patient, but with COVID restrictions we have to reduce that to 15 minutes as per the RACGP standards and the Queensland Health Advice. So we had in-services in place where we were educating staff about each and every updates coming from regarding COVID-19 during this time period. So everybody was quite up to date with COVID-19 criteria that needs to be met before we can go and process other procedures.
So in terms of staying in touch with people during this time, we were just really strong in our communication that the clinic was still open, that you could make a call, and we could follow up with a call back to you, that you could also still come to the clinic. There would be some changes in terms of pre-screening, but we were still here and could see people. So there was a lot of messaging around that work. In terms of our community teams and the teams that I manage, nothing really changed. They kept seeing the people that they were case managing and supporting and have continued to do so through outreach visits, street-based visits, home visits and phone calls. All the time making sure they were adapting their practice to what was taking place. We did implement some new changes through the use of Telehealth, which was fantastic. We were able to call people and let them know that we could talk to them over the phone and consult with them over the phone. And that's been an amazing strategy to be able to utilise. That's often only available for rural and remote consultations or in First Nations healthcare. Being able to do that for people who are homeless and at risk and highly vulnerable and who have very little supports was amazing, being able to make that call. One of the challenges though for some people is they didn't have a phone. So we had to look at getting people a phone and trying to pay for a SIM card and making sure that that number was connected so we could call them or they could call us. So there was a lot of that going on as well in our teams that I've been involved with, and here at the clinic, trying to work out, do you have a phone? And now it seems like the new norm. We've just adapted to operating in this space. We're cognizant of what we need to apply. We know that we need to stay on top of it and we need to adapt our practice every time something changes, and that it'll be continually a cycle of review and change as we move through what might be the next second wave of COVID, possibly not, but it probably will be. What would that look like? We just need to keep working through it. And I guess central to all of that is the people that we are here to support and to care for, and trying to make sure that our services don't stop, that we continue to deliver those services.
Telehealth is a blessing for us as we can provide clinical services over the phone, anywhere, anytime, such as an outreach or in their home. People who don't have any telehealth services available, we invite them with our support team to come to the clinic and provide the same services over the phone in the isolation room with the direct contact with the patient and the doctor. So basically we were able to achieve a great outcome in terms of our patient satisfaction as well as the clinic doctor's satisfaction in terms of management, in-reach and outreach.